So, hey, Dr. Beebler again. We're having another episode of Nurse and a Doc, and I'm here,
Yeah,
Keith Beebler, with my buddy Jordan, who is my former employee, but also has now graduated and is now a fully fledged nurse. And so we're here to talk about all things integrative medicine, functional medicine, quantum biology, you name it. And I think Jordan has a fantastic topic for us this week. So I'm going to let him take it away.
yeah, we're going to be talking about hormonal health and kind of addressing this idea that at the same time that we have like that this is hormones, this is neurology, this is GI, this is cardiology, and they're all their different things. And then we have mitochondria here, but um, how really is it? Is it like they're all their own boxes? We also have mitochondria in its own box. How would you really actually organize that?
Yeah, man. I think it's a great question. And I think this goes really to the heart of how medicine is organized in the more of a conventional system versus the kind of more integrative or holistic medicine, however you want to call it, right? So, in conventional medicine, we have these vacuums of like, okay, I'm a cardiologist. I only take care of the heart and blood vessels, right? And I'm a gastroenterologist. I only take care of what comes, from the mouth to the to the rectum and the anus, right? So my point is that it's very separated, and I think in some ways it makes sense. Like obviously, a cardiologist is specialized in procedures that have to do with that area of the body, or a gastroenterologist is specialized in procedures that have to do with that area of the body. But in terms of like how the body functions, it makes really no sense at all, right? Because everything's intimately connected. If just talking about the heart and the gut, for example, like if the heart wasn't pumping, there'd be no blood to go to the gut for it to be perfused and for it to function correctly, right? And if there was no brain and there was no nervous system, then there would be no autonomic systems to make sure that there was peristalsis and there was, proper mixing of, food in the stomach and stuff like that, right? So nothing happens in a vacuum. And so what I'm going to say is that nothing happens without mitochondria, right? Every cell, minus red blood cells, have mitochondria, and so all of those cells need energy that the mitochondria provide for proper functioning. So there's no question you can ask me about the human body that doesn't relate back to mitochondria in some shape or form.
Right. So I don't know if we could have possibly like a graphic for the audience here, like but in
Yeah, I
reality,
think the way I would say it, dude, is that in the middle is, the cellular health. And within the cellular health, the middle of that is bioenergetics and mitochondrial function, right? And if you don't have mitochondrial function and bioenergetic health, the cellular health is not good. And then every cell type has different functions, right? And some cells are producing hormones, and those hormones are not going to be able to be produced in the way they're supposed to if the mitochondria and the bioenergetics of the cell are not functioning adequately. So the middle is bioenergetics. Without energy, there's no life. You're just a bag of proteins and fats and carbohydrates, and nothing is animated, and there's no life. So bioenergetics of the cell is central to everything.
perfect. So um mitochondria in the middle, and then from there, all these other what sometimes are thought to be their own box. Not really, they're connected centrally to, as you mentioned,
100%.
mitochondria, biogenics, and the cell. Um, can you explain the relationship then between mitochondrial health and hormonal health, endocrine health?
Sure. Uh, Mitochondrial health and hormone health are intimately tied together. You know, um, you know, kind of like I talked about cells, different cells, specialized cells, uh, produce hormones. Okay. And in order for those cells to be able to produce a hormone, they're going to have to be powered and energized. There has to be gene transcription and translation, and then proteins are made, and then those proteins are going to be able to, allow things to be created in the cell, right? And that those processes require energy. So first and foremost, the mitochondria power the cell to make sure that they can make the hormones and to begin with, right? And then what's cool is that the mitochondria are related to both the end action of those hormones, right? So some of those hormones will act, on the same cell that they were released in, and then they'll act distantly throughout the body if it's a hormone that is secreted into the bloodstream, right? And so what I'm saying is that the thyroid hormone that's made by thyroid cells, right, that gets produced and affects all the other cells, will then affect the performance of the mitochondria within every respective cell. So I think thyroid hormone is a great example, because thyroid hormone is related, is related to pretty much every cell. And so when thyroid hormone is released adequately, it's going to have an action, at the level of the nucleus, because it acts in the nucleus, but it also acts in the mitochondria as well. And so when there's adequate hormone released, that hormone is going to either positively or negatively affect the performance of the mitochondria. So not only does the mitochondria affect whether that the hormone's released, then the hormone itself is going to feed back and actually affect how the mitochondria performance is. And then in some cases, because the majority of the cytochrome P450 system is on the endoplasmic reticulum, some of the cytochrome P450 system is within the mitochondria itself. So it's also going to help with detoxification and disassembly of hormones that are already created. So again, they're intimately involved.
And it's really not a chicken or the egg scenario. It is mitochondrial first and then hormone, right?
Yeah.
So just to recap what you said, like using that example of the thyroid, a thyroid cell with by the means of the mitochondria could help produce T4, T3, and then that hormone could come right back to almost even the same cell mitochondria and affect it.
Yeah.
Is that how negative feedback loops work at a very cellular level?
Not classically. Classically, hormone feedback loops would have to do with other hormones, right? So for example, like let's say if we're using thyroid, T4 and T3 would feed back on the pituitary gland to either upregulate or downregulate TSH, and that TSH would then upregulate thyroid hormone production, or if a lack of TSH would downregulate thyroid production. Generally, when we think about feedback loops, we think about within the actual hormone axis. So in that case, the hypopituitary thyroid axis, or the hypopituitary adrenal axis, or the hypopituitary sex steroid axis. So it would be mostly hormones affecting other hormones. In this case, this is hormones affecting cellular performance, which then affects hormones. So it's not quite the same relationship that we normally would think about with true feedback loops. But there definitely is. They definitely both affect each other. There's no question they are involved with each other.
Okay. What's the role of the mitochondria in the negative feedback loops?
Well, if the mitochondria are not performing, I guess I'll try to explain it a different way. So the mitochondria are not performing, right? They're not making ATP, they're not making energy, right? The cell cannot adequately release and produce and do its job, right? So this type of cell, let's say it's a thyroid hormone cell, it's going to not be able to produce as much thyroid hormone because it's not powered enough to do it, right? And then if there's not enough thyroid hormone coming back to that cell, right, or cells like it adjacent to it, or other cells distant in the body, right, then the mitochondria will suffer because that hormone is not positively affecting it. That would be the positive feedback loop. However, another feedback loop would be like, for example, and we'll talk about this later in the series, but cortisol. It's a double-edged sword. So cortisol in the acute setting can actually improve mitochondrial performance. However, chronic stress and chronic cortisol release can actually reduce mitochondrial performance. So it's not even black and white like that. Sometimes it's just like whether it's present or not, or if it's present acutely or present chronically. Does that make sense?
Yeah, it makes sense. So so then could we say if you have, like, let's just say shot mitochondria, doesn't matter how much TSH is released to boost the thyroid, if the mitochondria in that section are just, very high heteroplasmy, it's not really gonna function. There's gonna be
Well, I think what I would say is I'd stop you and say, if the thyroid and let's say we're talking about pituitary, if we're talking TSH, right? So
right.
if the thyroid, if the mitochondria pituitary were shot, then you couldn't even make TSH, right? However, if you were able to make TSH and it went to the thyroid itself, and the mitochondria heteroplasmy and the thyroid was high, and you were
Right, that's
having
what I'm saying.
poor ability to make thyroid hormone, thyroxine or T4, then you're right. It would negatively affect the ability for that to, no matter how much TSH is there, right?
And that would show up on labs, right?
100%. That should raise your TSH and show hypothyroidism. Yep.
Got it. Um, so a lot of times, I guess, as a patient, one could go to the doctor and assuming this is a holistic, maybe a functional medicine doc, provider, and they'll have, okay, now you are on a GI, now you are on a endocrine, a hormone program, and now you are on a mitochondria program. Is that the right mindset in light of what we've talked about to have, or is there a better way to, approach matters?
Well, I think this is where style comes into it, right? Um, Obviously, it depends on the. So people who are integrative medicine or functional medicine doctors, they come from a variety of backgrounds. There can be chiropractors, there can be Chinese medicine acupuncturists, there can be nutritionists, there can be conventional doctors of different backgrounds, right? There could be gastroenterologists that are functional medicine doctors, there could be cardiologists that are functional medicine doctors, there could be MDs versus DOs, and even within those uh, disciplines, even though we all try to practice the same medicine on the conventional side, um, there's different styles that you're taught in different schools, right? Even different residency programs. So my point is there's different styles of medicine. And I think that if you were to just go through the IFM, for example, the Institute for Functional Medicine, I think you would be very, I don't want to say confused. That's not the word I want to say, but I think you would have very little guidance in my experience when I went through of in what combinations do you give people programs and supplements, and how do you help people, right? And I think that's where, for example, the post IFM fellowship that I did that was a year long with Dr. Kalish, I think it was very helpful for me personally because at least he had a roadmap of like how his mentors over the years taught him to present a treatment plan in a very kind of like stepwise and logical fashion. Now, even that is kind of, debatable whether or not that is the right way to do it, right? Like, I think it's a logical way. I think it makes sense the way they do it. And it's definitely had influence on the way that I practice and the style that I practice. But I think that still there is a lot of separation within even holistic medicine. I'm going to do, like you said, I'm going to do a hormone program. I'm going to do a mitochondrial program. I'm going to do a GI program. I'm going to do a detoxification program. When all of those are intimately involved, like you really can't do a program for one thing that doesn't affect the other ones. They're just unlikely. Like I'll give you an example. If let's say hypothetically, if a person has GI, dysbiosis, imbalance of good bacteria, bad bacteria, or they have leaky gut syndrome or something like that, right? That in of itself will cause increased inflammation. Increased inflammation can then decrease mitochondrial performance, right? And energy production, which then will decrease the ability for the body to, mount a good offense against invaders. It'll be able to repair itself like it's supposed to at the GI tract level, right? So if I fix someone's GI tract first, let's say, it's going to have an effect on mitochondria. It's going to have an effect on hormones with the brain gut axis. It's going to have an effect on a lot of different things, hormones, et cetera, right? So nothing happens in a vacuum. So my point is, by saying that, is that if you can understand that everything is connected, you'll know that no program is truly just a mitochondrial program. No program is just a hormone program. No program is just a GI program, because everything is connected and it works synergistically. I don't know if that confuses or muddies the waters, but does that help?
Yeah, that makes a lot of sense. And I know you mentioned made quite a bit of reference to functional medicine. Would this vary at all if we were to combine it with the School of Discipline and School of Thought of quantum biology?
I do think it changes it a lot. I think that functional medicine is a step in the right direction. I just think it's incomplete, and it doesn't go to the depth that I think that the clinician these days needs to go to, especially since there's a lot of technologies that are coming out that could be helpful for the human body and the human organism and diseases that have to do with quantum principles. And I think that it would be very hard to recommend a lot of those things if you didn't have a deep understanding of that type area of science.
Can we go into how it would modify, let's say, the clinical approach to treating hormonal health versus mitochondrial health? How would that change the um, practitioner's approach versus comparing it to the functional medicine style that you would maybe like Dr. Kalish in his school,
Sure.
his fellowship describes you have like adrenal, GI, hormone.
Right. Yeah. So what I think I would say, the easiest way to look at it is from like, let's say we're focusing on the mitochondria, which is going to affect everything else, right? We know that, right? And what I would say is, you know, a program that would be based off just truly functional medicine may include things like intermittent fasting, may include something like a ketogenic diet, may include certain supplements like amino acids or other things, okay, that can help the mitochondria, all right? However, I think when you look at and to some degree exercise and sleep, I'm not saying functional medicine doesn't ignore that thing. I'm just saying that like, however, when you're looking at it from a quantum biologic perspective, you're going to be looking at, okay, are you, first of all, you're going to be looking at mitochondrial dynamics, which is what our next series is going to be about. Okay, we're going to be talking about two big ones, which is mitochondrial biogenesis and autophagy or mitophagy, which is mitochondrial specific autophagy, right? So when I was in functional medicine training in particular, when we talk about autophagy, let's say, we knew there were certain substances that can increase autophagy, and then we knew there were certain practices that could increase autophagy, right? And then there were certain substances that could improve mitochondrial biogenesis. However, the quantum clinician would have a lot more tools at their disposal that are cheaper, free, more sustainable, and probably more effective, right?
So it sounds like the quantum approach.
Well, let's put it this way. So I think it adds a lot of uh, clarity to the root causes of diseases, right? It adds a lot of clarity to the root causes of diseases. Okay. So, for example, you know, when you start adding in things like your light environment, your sun exposure, when you start adding in things like EMF, and you start realizing how it affects your melatonin production or your, which affects mitochondrial function and redox, right? Like you start to see like how things connect better, I think, and you start to look for things that other clinicians aren't looking for. So, for example, let me just tell you that as a functional medicine doctor on a person, let's say a person came in with fatigue, okay, which is a very vague complaint that is a very common complaint as well, right? I would look as a functional medicine doctor, I'd be looking at if they're anemic, I'd be looking at heavy metal toxicity, I'd be looking at their hormones, whether it be their thyroid, their adrenals, their sex steroids, right? And other things, okay? Vitamin levels, etc. I may order blood and urine and saliva and or saliva that would help me confirm those concerns, right? And maybe if I was really good, I may order like an organics, which is going to help me look at the mitochondrial function. Okay. But that's probably where I would stop, right? Like in that investigative practice. And I think that when I'm adding in more of a quantum perspective, I'm asking different and better questions to patients to help uncover additional root causes that maybe you wouldn't have thought about or seen otherwise. And so, for example, I may ask about whether or not you have a Wi-Fi router in your room. I may ask about how much time you're spending outside. I may ask about, where you're doing your exercise. Are you doing it in a gym under blue light? Or are you doing it outside? I may be asking myself, what type of exercise are you doing? Because there's different exercises that have been shown to affect mitochondria differently in the studies, right? I may ask about their deliberate cold exposure. Are they getting infrared light, for example? I may be asking, whether or not they're getting light at night, because I understand that physiologically those are going to affect different hormone systems in your body, and that's going to affect mitochondrial performance ultimately, right? Which then, as we know, it being central, it's going to affect everything else. So I think that it gives me more tools to look for root cause analysis, but it also gives me more tools for therapeutics than I would as a conventional, it sounds weird, a conventional functional medicine doctor, or maybe a functional medicine person only trained versus someone who has a more quantum biological perspective, which I'm very grateful to have.
Right. And I guess thinking, how does this all affect is there any difference apart from what you've explained already? Would this have any other implications for women's health? I think a lot of times when we think about hormone health, we think about women's health, right?
Yeah, I don't know if I do. I'll be honest with you. I mean, I think that generally more women go to doctors than men. So I think that since we're two men, we're talking about hormones. Well, of course, we're thinking about testosterone. But I think that if you really think about, where hypothyroidism affects, is mostly women. You know, Adrenal dysfunction is probably more likely going to be caught in a female, just because they're more likely to come to a doctor and complain of something. You know what I mean? Men are just, a lot of times we're stoic and we don't want to come to a doctor. So it's not that we don't have the problem, it's just that we don't go to a doctor and make the case that we need help. You know what I mean? Sadly.
We're just healthier.
No, that's not true. Not true at all. But that being said, yeah, I mean, I think that it's going to affect people, both both sexes, men and women both, in very similar ways. However, the incidence of some of the thyroid problems in particular are higher in women. Um, and obviously, there will be a difference when we're looking at, estrogen, progesterone levels versus testosterone levels, DHT levels, other, androgen levels in men. So there is a difference.
And sometimes in quantum biology, I believe it's said that hormones are really light signals. Can you elaborate on that? It kind of really changes the
Hormones are
normal
light signals.
perspective, or
Well, I probably can't explain it the way that I would love to explain it, like Jack Cruz is able to explain it. But what I would say is that, you know, light has an innate ability to change our physiology, right? And light works many different ways, and in ways that we're still discovering, and ways that I don't know about still. But let's talk about light the way that we can break it down pretty easily, whether it be UV light and the way it acts on vitamin D, and vitamin D levels are correlated with testosterone levels. It also affects thyroid performance as well. And then
so.
Go
Sorry.
ahead.
So could we say hormonal health is an expression of your um, light environment
Well, that's what I'm trying to
and
say, is like
different
light,
light?
light in the way that I understand it, and the way that, I think that I've seen published in the literature, and the way that it's being hypothesized to be used, and the way that other thought leaders that are much brighter than me have been able to, explain, is that yes, light is much more important than we realize. Most people realize, probably more important than I even realize, and I'm really interested in this. And it's going to affect several different hormones, because your light environment affects your mitochondrial health first and foremost. And if it affects mitochondrial health, we know it's going to affect everything, right? But certain frequencies of light, like purple light, blue, UV light, can affect just vitamin D directly, right? It takes UV light in order to convert cholesterol to vitamin D. So that's a direct correlation between light and hormones, right? And overall health. And then in addition to that, a lack of blue light at night, for example, is what helps your body produce and release melatonin. So there's another hormone directly affected by light. Then the other ways light, that at least that I understand, would be indirect through mitochondrial function and through energy, bioenergetics, and things like that.
Right. And there is kind of literature out there showing that I think in this case I've read about it was men that were being studied that who get UV and UVB exposure tend to have higher testosterone or
It makes sense
testosterone.
because it's definitely been correlated with vitamin D and having higher testosterones, right? So if UVB, for example, converts cholesterol to vitamin D, and you have a higher vitamin D level, then you would have higher testosterone levels. But it also affects mitochondrial health and improves mitochondrial function. So therefore, you're going to have improved mitochondrial function. So it's going to the cells that produce testosterone are going to have better output, very likely. And then there may be other mechanisms I'm not aware of.
Wow, so this kind of really I think for anyone, I guess this could be a pretty bold statement, but um, if one hasn't had the opportunity to learn about quantum medicine and is um, just treating someone with what's taught in the scope of functional medicine, as you just described, and not addressing these factors like EMF. What is your light environment? Are you going outside or getting blue light at night, Alan? Right?
Right.
Artificial light at night. That is the acronym for that. Um, then, as long as these factors still persist, it's going to be really hard to get that patient and fix things if those things are not being addressed or if you're totally unaware of them.
I agree fully. I think you're doing a disservice to patients by not knowing about these things. I think that you're missing several important root causes for disease creation with redox imbalance. I think that you are, unfortunately, it's a big blind spot for functional medicine, I believe. As a functional medicine doctor, I think it's a big blind spot for functional medicine. Um, I think that unfortunately
This
you may end up getting a treatment plan that is much longer or takes much longer to get better from if you're not addressing the quantum biologic perspective, root causes, and not using quantum biology to improve your treatment outcomes. So I think you're spot on with your assessment.
Okay, that's interesting because you said patient can get better, right? I would sometimes think that if that some of these blind spots, there are blind spots in life, I guess one could say, that they can be ignored because they're not that significant. You can ignore, for example, blind spot if you're driving, right? You're gonna crash. Maybe in other areas of life, they're okay. Nothing's gonna happen. Not too many repercussions. In this case, just having those blind spots, um, could we go as far as saying patient's just not gonna get better? For example, if I'm sleeping with a Wi-Fi router in the room, right, or nearby, I have a high EMF environment per se. Overall, I have moderate to high Allen exposure, which I think most people have. That's pretty reasonable to think, right? So
I think
far,
it's very reasonable.
and I don't go outside too much. At that point, or I wear sunglasses, and when I go outside, I wear sunglasses. We'll put it their way.
I
That way,
lather myself in sunscreen.
right? Exactly. So at that point, now in this hypothetical, I come to a functional medicine doctor. Um, these factors are not assessed. Could we go and say that no matter what happens, it's going to be very hard to see any positive, significant, long-term, lasting outcomes in this
I
case?
think it's fair to say. I think that in particular, I think that you're going to find lab values that don't make sense based off the questions and the assessments that you've made about the patient's lifestyle, right? So if you're only looking at exercise, diet, stress levels, supplements, and deficiencies, right? If you're only looking at those things, and maybe you're looking at toxins and things like that, right? If you're only looking at those things and you've addressed those things, and you're like, man, the person's eating well. They say they're sleeping 8 hours a night. They say they're not under any stress. I don't understand why I'm seeing this inflammation or why I'm seeing this oxidative stress markers elevated. Where is the cause coming from, right? It leaves you with these question marks of
Okay.
where are the drivers? Where are these drivers coming from, right? And if you're not looking for those things, these invisible things, unfortunately, not all invisible, there's a visible light spectrum, I guess. But if you're not looking for these mostly invisible things, right? Then you're missing nodes or modes of damage to the body that is reflected in labs, which reflects in downstream pathology, right, or disease, that you're not going to understand where those drivers are coming from, and you may end up treating, instead of treating the root cause or the driver of disease, you end up treating just the inflammation or just the oxidative stress without knowing where it's coming from, right? And then you're stuck because now you're treating something you don't know where it's coming from, and you don't really know how you can stop those treatments for the inflammation or the oxidative stress, because now you're like, I don't know where it's coming from and I don't know how I can stop because it's going to keep going if I stop it, right? So you're really kind of stuck as a clinician and you're kind of scratching your head like, where is this coming from, So I think, yeah,
and,
I think it is.
and you can like compensate with like supplements, diet, exercise, the base some of these more basic approaches that are seen. You
Don't, I
can
mean, don't get me
really
wrong, Jordan, like you can make you can make improvements in people's life by changing people's diet, get people to sleep well, by getting people outside, get people exercising, get people fasting. There's things that you can do to make people better and give people supplements, right? You can, I think that there's improvements to be made. I've seen people, before I had this degree in this area of knowledge improve, but I just don't think you're going to have the long lasting effects. And you may be stuck where you're like having to treat people again and again, or having to be on programs for long periods of time, if not ever. And then at that point, how are you really, much better than the conventional people, like giving people a band-aid for the rest of their life. I don't see how that's the case. The goal should
Well,
always
I
be
think
to get off of things. That's my goal. If someone comes into my realm, my goal is to get you off something. I want you off of that drug and or that supplement.
get them off that and on nature.
On nature, right? Exactly.
Connected to. Well, I think this has been a very insightful conversation we've
I
had
think it has been
today.
too. I think it has been too. I think we probably went long enough. I think these are great discussions and great questions, and definitely kind of challenged me to try to give a good explanation. And hopefully, I did a good job. And if not, hopefully, people were able to, leave comments in the comments and help us understand what we maybe didn't explain well, or maybe a question that was missed.
Right. And if you guys, as always, as you've kind of alluded to, Casey, if individuals do have any questions, even if they're totally unrelated, put it down in the comments.
Right. All right. Well,
Right.
Jordan, it was nice talking to you again. And until next time.
Until next time, take care.
See you.